Thank you. So, Umberto, if you will start to read as the patient, you may start reading now.
Okay, only the yellow mark?
Yes, just the yellow.
Okay, let's start. I think I may have a fever. It's so cool in here.
Okay, that word is cold. Cold.
Cool.
I think I might have a fever. It's so cold in here. Again.
I think I might have a fever. It's so cool in here.
It's so cold in here.
It's so cool in here.
Again, I think I might have a fever. It's so cold in here.
I think I may have a fever. It's so cool in here.
I think I might have a fever. It's so cold in here. Again.
I think I might have a fever. It's so cool in here.
Cold, cold.
Cold, cold.
I think I might have a fever. It's so cold in here. Again.
Okay, I think I might have a fever. It's so cool in here.
Cold, cold.
Cold.
It has the sound of K. It has the sound of K. K. O-L-D. Cold, cold.
Cold.
I think I might have a fever. It's so cold in here.
It's so cold in here.
Okay. Again, nurse, I think I might have a fever. It's so cold in here.
Okay. I think I may have a fever. It's so cold in here.
This word is might. Might.
Might.
Nurse, I think I might have a fever. It's so cold in here.
Okay.
Again.
Nurse, I think I might have a fever. It's so cool in here.
Here, let me check your forehead.
What do you think?
You feel a bit warm. Let me get a thermometer to check.
How do I raise my bed? I can't find the controls.
Raise. How do I raise my bed?
How do I raise my bed? I can't find the controls.
Here you are. Is that better?
Could I have another pillow?
Could I have another pillow?
Could I have another pillow?
Certainly. Here you are. Is there anything else I can do for you?
No, thank you.
Okay, I'll be right back with the thermometer.
Okay. Oh, just a moment. Can you bring me another bottle of water too?
Certainly. I'll be back in a moment. I'm back. Here's your bottle of water. Please put the thermometer under your tongue.
Thank you. Put the thermometer under the
Tongue.
tongue.
Yes, you have a slight fever. I think I'll take your blood pressure as well.
Is there anything to worry about?
No, everything's fine. It's normal to have a bit of a fever after an operation like yours.
Yes, I'm so glad everything went well.
You're in good hands here. Please hold out your arm. Okay, so did you understand the dialogue, Humberto?
Yes.
Tell me what the dialogue is about.
It's about the conversation between patient and nurse. It's about some concerns about the patient and how the nurse handled the situation.
Very good. Did the patient ask the nurse for anything in particular?
Yeah, well, about the fever.
What did the patient
And
ask? What did the patient ask?
the patient asked about, I forget the conversation, but I remember the patient was asking about the fever, if it's something to worry about, and they need a bottle of water.
Mm-hmm.
Yeah,
And
and the pillow, and the pillow.
and the pillow. Did the nurse give him a bottle of water and a pillow?
Yeah, yes, she did.
Yes, she did. Do you think that this was a nice nurse?
Absolutely.
And what is the first thing that made you remember she was a nice nurse?
Uh, yeah, because she brought the bottle of water,
Mm-hmm.
and she have a very good attention with the patient.
Very good. She paid very good attention to the patient. Very nice. So it does appear that you understood exactly what the conversation was about. Now let's check a few vocabulary words. Could you read these words for me?
Okay, to take some blood pressure.
Mm-hmm. Could you read the
uh,
sentence? To check someone's blood pressure. The next one.
Operation, surgical procedure.
Good.
Fever, temperature that is much higher than normal.
Mm-hmm.
To check someone's forehead. To put your hand between the eyes and hair and check for a temperature.
Okay, good.
Slight fever,
Light fever.
slight fever.
Mm-hmm.
Body temperature that is slightly,
Slightly.
likely higher than normal.
Okay.
Thermometer,
Thermometer.
instrument used to measure a temperature. To rise and lower the bed. Putting the bed up and down in a hospital.
Putting the bed up or down in a hospital.
Controls, the instrumental that allows a patient to move the bed up and down.
The instrument that allows a patient to move the bed up or down.
Okay. Pillow, a soft object that you put under your head when sleeping.
Very good. Any questions about any of those words?
No, everything's clear.
Fantastic. Now let's look at the quiz. Choose the best answer from the choices below. Okay.
Okay.
Number one.
We don't need to take a picture.
Read the question.
Okay. We don't need to take Peter to the hospital. He only has a slight fever.
Very, very good. He only has a slight fever. Good. Number two.
Okay. Number two is what problem does the patient think she has? A fever.
Very good. A fever. Okay. And the next one is number three.
You can use these controls.
Controls.
To rise. Oh no.
What? Remember what he wanted to do with the bed?
Yeah, you can use these controls to rise. Rise. Yeah, and lower the
Very
bed.
good. Lower the bed. That's correct. Number 4.
What does the nurse think?
Answer.
Okay, that the patient has a sluggy fever.
Very good. Number 5.
Could you check my forehead to see if it feels warm than usual?
Warmer.
Warm,
Warmer.
warmer.
Number 6.
Don't forget to put a soft pillow under your head before you go to bed.
Good. Can you read that? Don't forget to put a soft pillow under your head before you go to bed.
Yeah, don't forget to put a soft pillow under your head before you go to bed.
Very good. Number 7.
What other problem is the patient having? She's, I don't remember. She's very hungry.
No.
Okay, she can't find the bed controls.
Right. So, okay. So she wasn't hungry. Number 8.
Okay. What request does the patient make? She asked for an extra pillow.
Very good. Number 9.
What other problem might the patient have? She's thirsty because she asked for a bottle of water.
Very good. And the last one, number 10.
Okay. My need surgeon was successful. I can finally walk without pain again.
Okay. So it could be surgery and operation, so they both would be correct. Okay, so I would say that 2 out of 10 is not bad. Your score would be approximately 80 to demonstrate your comprehension. So that was quite good. Thank you so much for that. I really appreciate it.